Welcome FHS Infodrive 2021. Good evening, everyone. My name is Kish, motoriser Hesipag-Arbeider, and a volunteer of the Filipino Helping Society, or FHS, Team Helsa of Beldidighet. And I am with my teammates, Yen and Kate. And you can call us the
The
QuaranQueens.
QuaranQueens.
Together, we will give you updated information about each topic.
QuaranQueens.
Before we start, let us hear short information from Yen and Kate.
Thank you, Kish. Hi, everyone. Good evening. My name is Yan, and a volunteer of Filipino Helping Society, or FHS, Team Helsa Overdedehe. And Kate?
Thanks, Kishan Yan. Kate is my name today. Also volunteer of the Filipino Helping Society or FHS team, Jose Obelidehet. I welcome you all to our newest program, FHS COVID Infodrive 2021.
Thank you, Yen and Kate. Now let us begin. For the first topic is the entry quarantine upon arrival in Norway from red and yellow countries or regions. This is from the Norwegian Institute of Public Health, updated 15th March 2021. The quarantine regulations will be updated as a new information becomes available and can change quickly. So familiarize yourself with which regulations apply to you when you return to Norway. On the side, you will find the maps of the red and yellow countries in Europe. The Ministry of Foreign Affairs advises against all international travel that is not strictly necessary. The government imposed stricter rules on foreign nationals who seek entry to Norway from January 29. In general, only foreign nationals who reside in Norway will be permitted to enter, but there are certain exceptions apply. But how long will the strict entry rules apply? The government has stated that the strict entry rules will continue to apply at least until 7th April. They may decide to prolong this period. We will update here when we receive new information from the government. Guest workers and family members, such as grandparents, adult children, parents of adult children, or boyfriend, girlfriend, can therefore no longer visit for now. So, this is still mandatory testing, travel registration, quarantine, and quarantine hotels for those who can travel to Norway. There are more detailed information about this at udi.no. Rules and requirements when entering Norway. Rules for quarantine and testing on arrival are updated continuously and can change quickly. From Wednesday, 17th March, there are new rules about who must go to a quarantine hotel upon arrival in Norway. Anyone undertaking unnecessary leisure travel abroad must stay at the quarantine hotel when they return to Norway. In addition, the current strict entry restrictions are being extended, which generally means that only foreigners residing in Norway will be allowed to enter the country, initially up until 7th April. And also, people traveling for leisure purposes must stay at a quarantine hotel at least until they receive a negative response to the test, taken no earlier than 3 days after their arrival. The municipalities will not oblige to offer testing, and being tested on day 3 will not be a right. This is from the government.no. You can read more on the site. As it's been said, familiarize yourself on where you belong to the category. The following requirements apply upon entry. Registration obligation for arrivals in Norway. Everyone who crosses the border into Norway from areas with a quarantine duty, red countries areas, including Norwegian citizens, must fill in a travel registration form before arriving in the country. You can register at entrynorway.no. There's registration form there. You can register. Also, the next is requirement for a negative test before arrival in Norway. This is from the Law of Data. This is the COVID-19 regulations, section 4A at lovedata.no. You can check it there as well. People who are not Norwegian citizens or resident in Norway and arrive in Norway from areas with a quarantine duty must present a certificate of negative COVID-19 test. Approved test methods are PCR or rapid antigen test. The test is to be taken within the 24 hours prior to arrival in Norway. For people arriving by plane, 24 hours apply before the scheduled departure time of the first flight. The certificate must be in Norwegian, Swedish, Danish, English, French, or German. People who do not present the document that they may have the certificate may refuse entry. The quarantine does not apply to people who can document that they have undergone COVID-19 during the last 6 months with an approved laboratory method. The requirement also does not apply to certain other groups mentioned in Section 4A, A to Q in lovedata.no, although it is still recommended that they are tested before entry. The next is test upon arrival. Anyone who has stayed in an area with a quarantine duty during the last 10 days before arrival has a duty to be tested at the border crossing point. Upon arrival in Norway, the test must be PCR or rapid test within. In the case of a positive antigen test, the person must take a PCR test within 24 hours of arrival. People who in the last 10 days prior to arrival in Norway have stayed in the UK, South Africa, Ireland, the Netherlands, Austria, Portugal, or Brazil, and are 12 years of age or older, or shall be tested with PCR at the boarding crossing site. Further information about the test at government.no. Parang, naano ako sa light, no? Sorry. Household members who live in a person who is in entry quarantine are also encouraged to be in a quarantine if they do not have separate bedrooms and bathrooms, or it is difficult to keep a distance of 2 meters. People who live with people in entry quarantine are encouraged to test themselves on day 7 after entry. If they have not been in quarantine themselves, also. Again, familiarize yourself with the rules that apply when entering Norway. My other teammates will gonna explain the isolation and also additional information about entry rules on helsa.no. And information for travelers arriving in Norway in several languages are also there at the Directorate of Health, helsa.directorata.no. And the next is the entry quarantine upon arrival in Norway. Everyone arriving in Norway from abroad shall be in a quarantine for 10 days, with the exception of specified countries in Europe with sufficient low transmission, yellow areas, and countries, unless they are mentioned in the exception provisions. People who come to Norway from abroad can be released from quarantine if they test negative for COVID-19 with PCR, not rapid antigen test, no earlier than 7 days after arrival. From 23rd February, there is also a requirement that people in entry quarantine who are not staying in the quarantine hotel must be tested with a PCR test 7 days after the arrival. Currently, vaccinations does not affect quarantine requirements, with the exception of healthcare workers who are critical to society. COVID-19 Regulation Section 6E. People who shall be in a quarantine after entering Norway shall stay at a quarantine hotel. There are some exceptions to the rules for quarantine hotels. It is described in the Law of Data, Section 5, and also there are special requirements for places of requirements when it is not carried out in a quarantine hotel. So here is the slide you will find about quarantine isolation. So I told you before about the isolation. My other teammate will elaborate about it. And also, and this is the map of Nordic region, Europe with status for entry quarantine. The map below shows the areas with quarantine duty that apply for travelers arriving in Norway from 15th March 2021. To clarify the recommendation to avoid all non-essential travel abroad, the government has decided that the countries and regions that were marked with green on the map should be marked as yellow. This is from the regjeringen.no. Currently, no countries are classed as green. If you arrive in Norway from a yellow area, you are exempt from quarantine. A red area, you must go into a quarantine for 10 days. A striped area, you must go into quarantine for 10 days. In yellow areas, transmission is considered to be so low that there are no requirements for quarantine, even though these areas are also have increased risk. In red areas, transmission is higher. Striped areas are not evaluated or there are insufficient data about transmission. When you arrive in Norway from a red or striped area, you should travel directly to an appropriate place to stay during quarantine, preferably by private transport, by car, etc. If you must be in a public place or use public transport, you must use a face mask throughout the journey until you arrive at your destination. Try to avoid departures where you cannot maintain a distance of 1 meter from others. There's no quarantine duty from the countries in the EU, EEA, Schengen, and Nordic regions with sufficient low transmissions. These areas are marked in yellow in the map below and will be updated once a week. Criteria for evaluating transmission. From 10th November, there are now exceptions from entry quarantine for travels from EEA countries and Switzerland, where there are fewer than 25 confirmed cases per 100,000 inhabitants during the last 2 weeks. So they are evaluated on a national level, no? And fewer than 4% positive tests on average per week over the last 2 weeks. In addition, there is a comprehensive assessment on the countries based on trends in infection rate and other relevant information. Assessments are made on a regional level when it is possible for health authorities to make assessments based on evaluation of the infection burden in each region. Currently, this only applies for the Nordic countries. Overseas regions and current countries outside EU, EEA, and Schengen. The overseas regions, including Gibraltar, are not covered by the travel advice linked to the countries in the EU, EEA, Schengen area. These overseas regions are subject to the same entry restrictions and quarantine rules as the other third countries outside EU, EEA, Schengen area. Examples of overseas regions are land areas in the Caribbean, North Africa, and are governed by a Schengen country, but are not included in the Schengen area. If you arrive in Norway from overseas regions and countries outside EU, EEA, Schengen, the so-called third countries, you must go in quarantine for 10 days. So the tighter entry restrictions introduced on 29 January 2021 will continue to apply until further notice. Initially up until 7th April, so they prolonged it. Strict entry rules will continue to apply even after 7th April. But the government will consider before Easter whether or not some groups will be permitted entry after this date. Reyengeren.no. This is from the Reyengeren.no. So that's all for now for the entry quarantine. Let's hear from Yen.
Thanks. And so it is really important to extra careful now, especially now still increasing the infected of COVID-19.
Yes, that's
So,
true.
yeah, so mag-iingat tayong lahat and always wear face mask wherever you go, especially in a public place.
Yes.
So
Thank
now,
you.
yeah, welcome. Now let us tackle about the quarantine and isolation. And this report is from the Norwegian Institute of Public Health and updated last March 5, 2021. So this is the question is how much social distance? According to the Norwegian Institute of Public Health, keep your distance to help slow down COVID-19. This is advice for everyone. Follow good cough, etiquette, and good hand hygiene. And you and your closet circle can be together as in normal. Keep a distance of at least 1 meter from everyone but your closet circle. If you have symptoms of COVID-19, you should stay at home and be tested. And then you are a close contact or coming home after international travels and require. So again, this is according to the Norwegian Institute of Public Health. Um, quarantine rules are: do not go to school or work, do not use public transport, avoid visits. You can go for a walk but keep a good distance from others, well over 1 meter. You should get others to shop for you. This is not possible. You can carry out essential errands but keep your distance and wear a face mask. Keep a good distance to other adults and older children in the household. People you live with are normally not in quarantine, then get tested immediately and after 7 days. If you have symptoms or respiratory tract infections, you should isolate yourself and be tested. A positive test result means that you go into home isolation. And also, you have confirmed or probable COVID-19 and are in home isolation. First, stay at home, keep away from household members. If possible, use your own room and bathroom. Clean surfaces to help you with food and shopping. Ask someone to help you with food and shopping. Discuss with your doctor how you should monitor your health. Your household members are in quarantine time and in quarantine. So this is advised for people in quarantine. When you are in quarantine, this is the following applies. First, for entry into Norway, you must go into quarantine for 10 days after arriving in Norway. The quarantine period may be shortened if you have a PCR test with a negative result no earlier than 7 days after arrival. For close contact, you must go into quarantine for 10 days after your most recent contact with a person who is infected. If you are staying with someone who receives a positive test result during the quarantine period, you must start a new quarantine period from the last time you had contact. The quarantine period may be shortened if you have a PCR test with a negative result no earlier than 7 days after your most recent contact with the infected person. Next, anyone who may have been exposed to COVID-19 infection during the past 10 days should be tested. You can be in normal contact with your younger children you live with, but maintain a distance more than 1 meter from older children and other adults. If older children in the household are in quarantine, where possible, it is recommended to avoid close or physical contact with other household members. This also applies to contact between other household members in quarantine. So for children and people in need of healthcare, however, the need for care must be given the highest priority. Next, do not go to work, school, childcare center, or other activities outside the home. Do not take long trips in Norway. Do not use public transport. Avoid places where it is difficult to maintain a distance from other people. As a rule, you should not visit public places like shops or other or shopping malls. If there is no alternative, you may go out to carry out essential errands to the supermarket or pharmacies. But ensure that you maintain a distance at least 1 meter from the other people. Wear a face mask and maintain a distance for 2 meters from others. So be alert for any symptoms if you develop an acute respiratory tract infection with fever, cough, shortness or of breath, or loss of sense of taste or smell while in quarantine. You will be considered to have probable COVID-19 disease. You should be tested as soon as possible and go into isolation at home until your test result is available. If you have other household members, it is recommended that they go into quarantine until your test result is available. If you test positive for COVID-19 during your quarantine period, you must continue your home isolation, and the contact tracing team in your district or municipality will carry out full contact tracing. With a negative test result, you must continue your quarantine as planned, but quarantine will end for other household members. So let's talk about quarantine hotels and exemptions. The general rule is that people arriving in Norway from countries and regions with a quarantine obligation must stay at a quarantine hotel. This does not apply to people who are residents or registered in the population register or have a permanent resident in Norway. And there are also some other exemptions. So, the infection control advice for places for quarantine where many live together. Here are some points to consider when arranging accommodation where many people are to spend their quarantine period or etc. Quarantine hotels and legal and financial conditions concerning such stays are provided by the Norwegian Directorate of Health. Risk assessment. First is risk assessment. Anyone who is responsible for accommodation for people in quarantine should carry out a risk assessment of the facilities and adapt the condition to ensure adequate infection control. The risk assessment of the accommodation must cover the following. First, which areas are suitable for those who are to be quarantined? How current infection control measures will be observed, social distance requirements, hand hygiene, cough etiquette, ventilation in the room, food serving, handling of laundry and waste. Plan for the wearing of face masks for people in quarantine and protective equipment. Action plan if quarantined people or employees become ill with COVID-19. The manager or employer at the accommodation must ensure that their employees are aware of the organization and responsibilities associated with those who are in quarantine. The municipal medical officer has medical responsibility for those who are to be quarantined in their municipality. In collaboration with the person responsible for the accommodation, the municipal medical officer must establish routines that protect employees against infection. Next is social distancing requirements. Assess the need for the marking of corridors and communal areas and whether there is a need to put up notices concerning social distancing requirements. Next is hand hygiene. Hand hygiene facilities must be available where people in quarantine spend time and in other communal areas where appropriate. Written Written information should be prepared concerning when and how hand hygiene should be practiced by both people in quarantine and staff. Next is protective equipment for employees. There is no routine need for the use of protective equipment. However, the manager or employer should carry out a risk assessment of the need to use protective equipment like face masks, gloves, overalls, and visors, and establish routines for their use. Employees must have received training on how to use protective equipment and in which situation it is required. So these systems must also be established for the purchase and sustainable storage for protective equipment. Next is food service. People in quarantine must eat in their room and must not use communal dining rooms or buffet service. Food should be served in the room by placing the serving tray on a table outside the room. Employees should knock and then move away from the door area. In the room, written information must be provided indicating that used serving trays should be placed outside the door used. Employees must transport and serving trays to the areas where they are will be clean. Next is laundry. Existing routines for handling used linen, etc., should be reviewed both with regard to internal routines and in connection with agreements with external laundry services. People in quarantine should change their bed linen and put dirty linen, etc. And the collection bag with must be provided in the room. In the room, written information must be available stating with linen or etc. The person in quarantine can place in the bag that personal clothing cannot be placed in the bag, and that full bags must be tied up and placed outside the door. So the employees must transport the bags to the laundry or other storage area separated from other objects until washing. Next is waste management. Existing waste routines should be reviewed to ensure adequate infection control. People in quarantine should place the rubbish in a refuse bag which must be provided in the room. In the room, written information must be provided stating the full refuse bags must be tied up and placed outside the door. Employees must transport the bags to the appropriate waste containers, cleaning, disinfection of the room. Quarantine people should clean their own room using disposable clothes. For the accommodation, it is sufficient to clean the room at the end of the quarantine period. Follow existing cleaning routines in addition to enhanced cleaning of surfaces that are frequently touched. Cleaning and disinfection at COVID-19 to sectors outside the health services. People in quarantine must be given information about the infection control measures, including first, the need to keep your distance, hand hygiene, and cough etiquette, regularly ventilate the room if possible, wear a face mask if the employee must enter the room or when moving, what to do if they become ill. Healthcare personnel from the municipality should preferably follow up those who are in quarantine. It is not recommended that employees enter the rooms of any who is in quarantine. If employees must enter the room, the person in quarantine must ventilate the room first, put on a face mask, and keep their distance. Employees must consider whether there is a need to use protective equipment if distance cannot be maintained. The person who is in quarantine should not mix with other people. Visits should be postponed until the infection status has been clarified. So the information on how people in quarantine should behave can be found under advice for people in quarantine. Routines if someone in quarantine for or an employee becomes ill. Via the manager or employer at the accommodation, the municipal medical officer must establish routines which explains how both the person who is in quarantine and employees at the accommodation are to respond if the person develops COVID-19 symptoms. So now let's talk about you have a COVID-19 or in home isolation if you are home isolation. So the following applies for people in isolation. First, wherever possible, you must maintain a safe distance from others. For children and people who need medical help and need for care should be given the highest priority. If possible, use a separate room and bathroom. Use your own towels and toilets. You should have food delivered to your room or be alone in the kitchen. If you live with other people, you should go into isolation in your room and maintain the full social distance from those you live with. Do not leave your home, although you can go into your own garden or own balcony while maintaining a distance from others. Get help from others to report get help from others to perform essential errands. You and members of your household cannot have visitors. If you have to be nearer to other household members than 2 meters, it is recommended that you wear a face mask if your health permits it. Alternatively, household members should wear a face mask when they are closer than 2 meters to the person who is ill. It is not recommended that children under 12 to 13 years of age wear a face mask. Children under 2 years of age should not wear a face mask under any circumstances. Ask your doctor how you should monitor your health. Ring the healthcare service if you need medical attention because your condition has deteriorated. For example, you experience breathing difficulties or for other reasons. Explain that you have COVID-19 when you call. They will then be able to implement measures to prevent other people from becoming infected. Do not use public transportation. Clean your home frequently, especially surfaces such as bathrooms, sinks, toilets, door handles, and kitchen worktops. Ordinary cleaning products may be used. Place used linen or etc. and bedding directly in the washing machine and wash at a minimum of 60 degrees and cleaning during and after home isolation the people you live with must go into quarantine. And the last, the people you live with must be careful about the hand hygiene. It is especially important that the people you live with wash or disinfect their hands when they leave the room. You, the person self-isolating, are in and after coming into contact with you or equipment you have used and before leaving the house. And for more information, you must check the FHI or the Norwegian Institute of the Public Health. And that's all for now of about the quarantine and isolation. And now let's hear Kate of her report about the COVID-19. Thank you.
Thank you, Yan.
You're
Wow, that is
welcome.
very essential information. Thank you again. And of course, it is very important that we quarantine ourselves, most especially that cases are increasing right now. And we must also take our vitamins daily so to boost our immune system. And of course, stay home as possible as the government required us to do so. And now let's discuss about hand hygiene, etiquette, cleaning, and laundry. So the first thing is how to prevent transmission. The SARS-CoV-2 virus that leads to COVID-19 disease is spread primarily via droplet and contact transmission when the virus is transmitted from the respiratory tract of an infected person to a healthy person. Therefore, good hygiene is an important measure to limit transmission in the population. Cough etiquette and social distancing are crucial to limiting droplet transmission, while hand hygiene, and especially avoiding touching the face with unclean hands, is important to prevent indirect contact transmission. So first thing that we must know is a proper hand hygiene. So the first thing to do is avoid touching your face with unclean hands. Of course, this will prevent stop transmission via the hands to the eyes, mouth, and respiratory tract. The question is, when should hand hygiene be performed? First, before cooking or eating food. Next, after using the toilet or changing nappies, of course. And the next thing is with visibly dirty hands. If you feel your hands or if you see that your hands are dirty, so we should perform hygiene immediately. Next thing is after contact with bodily fluids, for example, after wiping the nose, after contact with animals, when you arrive at work, childcare center, or at school. After touching contact points in areas used by many people, including work, childcare center, or school. And at last, before putting on a face mask and immediately after removing it. There are people that might ask, which is better to use? Is it hand wash or hand disinfection? Well, both hand washing and alcohol-based hand disinfection are, in most cases, effective methods of hand hygiene. But there is one thing to consider. When you use alcohol-based hand disinfection, it is less effective when hands are wet, visibly dirty, or soiled with organic matter such as food or bodily fluids. Therefore, washing with soap and water is normally recommended as a method outside the healthcare service. However, during the COVID-19 pandemic, hand hygiene is performed more frequently than usual. Alcohol-based hand disinfection is easily available and less irritating to the skin on the hands. Therefore, it can be a good alternative to hand washing when your skin is dry and not visibly dirty. For the best effect, follow the manufacturer's recommendation for how much to use and how long it takes to work. So as you can see there on the picture below, you can see how to hand wash properly. First, wet hands with lukewarm water. Not cold, not too hot, but lukewarm water. And second step is to get a big squirt of soap and rub it all over both hands. Third thing to remember is palms, fingertips, and wrists. So whenever you hand wash, so you must rub your thumbs as well. Not only by rubbing your both hands, but you must do this as well, rubbing your thumbs. The next thing is your fingertips, like this. And third is your wrists. So you must also wash your wrists. And fourth step is rinse off all the soap. Dry hands well with a paper towel. Turn off the top with the paper towel and throw it away. So after drying your hands with a paper towel, do not throw it away immediately. So we can use that when we are going to close the top. So we don't have to wash again and again. So the transmission will never, yeah. And there's also choice of disinfectant. There's advice for choice of disinfectant. So first thing to know is alcohol-based hand disinfectants have been used by the healthcare system in Norway for several decades. Even though some react with irritated skin, experience show that all alcohol-based disinfection is effective and is gentle to skin and hands. So we must know that the alcohol concentration should be between 70 to 90 So that's the choice of our disinfectant. Hand disinfectants with active ingredients other than alcohol are also available. In order to be sold in Norway, these products, like alcohol-based hand disinfectants, must comply with the requirements of the biocide regulations. They must show documented effect according to ESNSS 1500. There is limited experience with clinical use of these products, of course. And there's also one thing to consider. How should you dry your hands after washing them? You can dry your hands with disposable paper towels or warm air hand dryers. It is important that hand dryers are kept clean. They should be designed so that water does not collect at the bottom and then blown out during use. Hand towels can be used in private homes but should be changed regularly. So when you're home, it is better to use hand towels. Even though we have a lot of paper tissue at home, so it's better to use hand towels. But of course, we have to take note that we should change it regularly, like every day. Warm air hand dryers should not be used in healthcare institutions. If you want to know more about that, read more about drying hands in the National Hand Hygiene Guide in the Health Service. How to prevent dry and sore hands. So it's just additional advice, Here are some advice to prevent dry and sore skin on the hands due to frequent hand hygiene. Since we are using alcohol, or since we are washing our hands more frequently than before, so it's better to prevent to dry our hands or getting sore with. First thing to know is use skin-friendly soaps, perfume-free, and has a 5.5 pH balance. And also use good quality paper towels to reduce drying out of the skin. At home, clean towels are a good option. Wash your hands in lukewarm water, not hot water, but lukewarm water. Wet your hands before applying soap. Of course, we don't want to wash our hands without wetting them first. Rinse your hands thoroughly after washing so that all solids are washed away. Pat your hands with a paper towel until they are completely dry. Avoid rubbing hard. Use hand cream to prevent dry and sore skin as often as needed. Example, after hand washing, more especially when we don't have that perfume-free soap, or we didn't recognize the normal pH balance that is required. So it tends to dry our hands. Gaya ng nangyayari sa hands ko ngayon. So we must use hand cream more frequently. And when using shared tubes other than people in the same household, it is important to ensure that tube opening does not come into contact with skin or objects during use. That is to avoid contaminating the cream. And one thing to take note, we don't use disposable gloves because transmission by hands wearing gloves happens in the same way as for hands without gloves. Therefore, we do not recommend the general use of disposable gloves. So, yeah, precautions with use of hand disinfectants. So, most of the time, people travel, go outside, take transportations, and because of that, we don't have the time to hand wash. So we just have our alcohols with us. Um, and at home, of course, there are people that don't prepare to hand wash, so they are just using alcohol-based disinfectants. So there are precautions that we must know about hand disinfectants. First, alcohol-based hand disinfectants are flammable. So do not store or use at high temperatures or near open flames. Next thing is hands must be dry after using hand disinfectants before activities that may involve contact with heat, sparks, or open fire. Normal drying time is 20 to 30 seconds. There are cases that have been reported where hands that are damp with alcohol-based hand disinfectant have been set alight after close contact with open flames. For example, when lighting a candle or lighting a fire in a stove. Next thing to know is hands must also be dry before touching nearby objects because of the risk of static electricity. Sparks can arise. Cases have been reported where hands that are damp with alcohol-based hand disinfectants have touched metal objects, causing sparks. And the last thing, alcohol-based hand disinfectants can be harmful if swallowed or if they come into contact with the eyes. Consider safe use and placement in areas where children, people with mental disorders, or who are mentally impaired or other groups are at increased or accidental ingestion. So yun na nga, we must be very cautious about those things, how to handle properly hand disinfectants, you know. We must do it not for our own selves, but for the other person as well in our household. So let's go on to cough etiquette. Avoid coughing or sneezing directly onto others. As you can see on the picture, we must avoid doing that, you know, coughing towards others. So we must know, we must distance ourselves when we feel that we are coughing or sneezing. And next, try to cough or sneeze into a paper tissue, carefully disposed of afterwards, or into the crook of your elbow if you do not have tissues available. So as you can see on the picture, if you don't have tissues available with you when you travel or you go outside, or there are times that you forget to bring your tissue with you, so we have no choice but to do that, to do cough or sneeze into the crook of our elbows. So we already know that. We already know those things as an individual, as a responsible individual. And yeah, that's all for a cough etiquette. So let's move on for the laundry and home cleaning. I think this would be the last information that I can share with you guys. So number one, there are different things to consider between households where coronavirus infection has not been confirmed and in households where infection has been confirmed. So first, in households where coronavirus infection has not been confirmed, normal cleaning can be performed. As you can see on the picture, the normal vacuuming, the normal washing can be performed regularly. When there's no person in households where coronavirus infection has not been confirmed. And in households where infection has been confirmed, we must take note that we must clean our surfaces that are touched by both the infected persons and others daily, such as bathroom sinks, toilets, door handles, and kitchen worktops. So as you can see on the picture, you know, we must be very careful and extra careful to do those things, most especially when the infection has been confirmed in your household. Thing that people around are used to touch daily, so we must do some extra cleaning. Yeah, and for laundry, ordinary detergents can be used, of course. Towels and beddings used by the sick person must be washed on a minimum of 60 degrees. Not 40, not 50, but 60 degrees. Other textiles at the highest possible temperatures. So as you can see, if the textile can be washed more than 60 degrees, so it is high as possible. So we can do that as possible, but not really less than 60 degrees. So that's very important. Clothes and textiles that have been in contact with the infected person should be kept separately from other objects before washing. Now we are used to it sorting clothes. But when in your households where the corona infection has been confirmed, so we must be take extra sort your clothes from the sick person clothes, so it will be a better um, option. And of course, after doing that, after doing the sorting and everything, wash your hands after handling the utensils. It's very important to wash the hands because we don't know that the virus or can be spread as well. And yeah, I think that's all for now. That's all that I can share with you guys. These information are, of course, came from the Norwegian Institute of Public Information from Health, and it was updated March 4th, 2021. Kish?
Wow, well explained, Kate. Those information are definitely a must know. Thank you, Kate. It is crucial that each one of us will follow the rules to stop the spread of coronavirus. And these measures may change, so keep yourself updated by watching news and press conference of the Norwegian government. Yen?
Mm, absolutely, Kish. These are some of the reminders also from Det Filippinska Hjälpsamfund i Norge. This is a part of integration and a voluntary activities of our organization. The work is primarily aimed at Filipinos and other minority groups living in Norway and Filipinos in the Philippines. Kate? Kate?
Visit our FB page at fhs.org.no and our website www.fhsnorge.org for more updates and other information.
This has been
Kish?
QuaranQueens. My name is Kish. Again, we hope that everyone will stay safe and follow the rules, the new rules, of course, because it's constantly changing. So, amidst the threat of this mutated coronavirus.
Totally agree, Kish. Let us
Mm.
all unite in fighting against coronavirus, of course, and the new variants by adhering to the measures. Again, this is Yen. Okay.
And
Okay.
my name is Kate. Thanking everyone for watching our very first report here in FHS COVID Infodrive 2021. Kish?
For the next corona report, watch our other teammates, the Pandemic Chicks, on 27th March as they provide new information about other
Pandan
essential corona
Chicks.
topics.
Indeed, but not for now. Let us end this report by reminding all to keep the faith and follow the preventive measures.